Hey guys, I'm Rhys, and today we're joined by Brycen. Say hello.
Hello.
So we're gonna learn about pandemics. We're basically gonna learn about its history, its symptoms, and its infection vectors, and how you treat it. So let's go, Brycen.
So, the most severe virus in total cases and deaths is the Spanish flu 100 years ago, which has 500 million cases and 50 to 100 million deaths. The COVID-19 is ranked 5th in total severity, with 4.5 million cases and 302,000 deaths. The least severe pandemic was SARS, with a total cases of 8,000 and 774 deaths.
So now let's look at SARS. The SARS virus lasted from 2002 to 2004. The SARS pandemic appears to have started in Guangdong province in China. It later spread across the world when an American businessman traveled from China to Singapore. The symptoms are flu-like symptoms and may include fever, muscle pain, lethargy, cough, sore throat, and other non-specific symptoms. The only symptoms common to all patients appears to be a fever above 38 degrees Celsius. SARS may eventually lead to shortness of breath and pneumonia. Either direct viral pneumonia or secondary bacterial pneumonia. SARS mainly spreads via bodily fluids, human to human transmission, and surface contamination. SARS can be treated with antipyretics, supplemental oxygen, and mechanical ventilation as needed, as SARS is a viral disease. Antibiotics do not have a direct effect but may be used against bacterial secondary infections. Antiviral medications are used as well as high doses of steroids to reduce swelling in the lungs.
Alright, for the next virus, Ebola. The Ebola virus started in 2014 and is still present. The first known outbreak of Ebola was identified only after the fact. It occurred between June and November 1976 in Nazara, South Sudan, then part of Sudan, and was caused by the Sudan virus. The first symptoms of the virus are fever, a sudden influenza-like stage characterized by feeling tired, fever, weakness, decreased appetite, muscular pain, joint pain, headache, and sore throat. The next symptoms include internal and external bleeding from decreased blood clotting and also cough or blood vomiting. 2 weeks after the infection, the infected person either dies or recovers from Ebola. The Ebola virus mainly spreads through direct contact with the blood or other bodily fluids of an infected person. This includes but is not limited to saliva, mucus, vomit, feces, sweat, tears, and breast milk and urine. Treatment includes an experimental serum that destroys infected cells. Doctors manage the symptoms of Ebola with fluids, electrolytes, oxygen, blood pressure, medication, blood transfusions, and treatment for other infections.
So now for cholera. So the cholera virus started in 1980s and is still present. This virus caused multiple pandemics, but the first one occurred in Bengal region of India, near Calcutta, starting in 1817 through 1824. The disease dispersed from India to Southeast Asia, the Middle East, Europe, and Eastern Africa. The primary symptoms of cholera is profuse diarrhea and vomiting of clear fluids. Severe cholera without treatment kills about half of infected individuals. If the severe diarrhea is not treated, it could result in life-threatening dehydration and electrocute imbalances. The cholera virus mainly spreads via fecal oral and route of contaminated food or water caused by poor sanitation. The cholera virus can be treated with oral rehydration therapy, also known as ORT, which is highly effective, safe, and simple to administer.
Alright, for the next virus, measles. The measles virus started in 1954 and is still present today. The virus causing the disease was isolated from a 13-year-old boy from the United States, then adopted and propagated on chick embryo tissue culture. Symptoms typically begin 10 to 14 days after exposure. The classic symptoms include a 4-day fever and the 3 C's: cough, coryza, and red eyes, along with maculopapular rash. Fever is common and typically lasts for about 1 week. The fever is seen with measles as often as high as 40 degrees Celsius. The measles virus mainly spreads via coughing and sneezing, easily being one of the most contagious viruses in history. The measles virus can be easily prevented in the long term with vaccines. Alright, for the next virus,
COVID-19, the one that's still present and the newest. The COVID-19 virus started in late 2019 and is still present. The COVID-19 pandemic started in Wuhan, China. It quickly spread almost entirely through human-to-human transmission across the world. Symptoms commonly include fever, cough, loss of appetite, fatigue, shortness of breath, sputum production, and muscle and joint pains. Symptoms such as nausea, vomiting, and diarrhea have been observed in varying percentages. The incubation period for COVID-19 is typically 5 to 6 days, but may range from 2 to 14 days. Although 97.5% of people who develop symptoms will do in 11.5 days of infection. COVID-19 mainly spreads via water, surface contamination, people coughing, and human-to-human transmission. COVID-19 does not have a vaccine, so in order to control it, doctors may give fluids to reduce the risk of dehydration, medication to reduce a fever, or supplemental oxygen in more severe cases.
for the next virus, AIDS. AIDS was first clinically reported on June 5, 1981, with 5 cases in the United States, and is still present today. The AIDS pandemic started in the United States and spread through drug users and homosexual men with no known cause of impaired immunity. Symptoms include fever, weight loss, sore throat, myalgia, enlargement of the liver or spleen, rash skin, headaches, malaise, nausea, and vomiting. AIDS mainly spreads via sex, bodily fluids, and mother-to-child transmission during pregnancy. AIDS currently has no vaccine or cure, but can be controlled with antiretroviral treatment so that the infected patients can live long and happy lives.
So, now for the next pandemic, which is the Russian flu. So, the Russian flu started in 1997 and ended in 1998. It had started in Russia and then went on to infect more in the United States over water. Symptoms include dry cough, sore throat, high fevers, no appetite, and difficulty breathing, like other flu viruses. The Russian flu mainly spreads via direct transmission, being inhaled by a person while airborne, and through hand to eye or hand to nose or hand to mouth transmission, either from contaminated surface or direct personal contact such as a handshake. The Russian flu can be easily prevented by vaccine.
Now for the next pandemic, the Asian flu. The Asian flu started and ended in 1957. The first cases were reported in Guizhou and in late 1956 or February 1957 and were reported in the neighboring province of Yunnan before the end of February. Symptoms include a dry cough, sore throat, high fever, no appetite, and difficulty breathing, like other flu viruses. The Asian flu, like other flu viruses, mainly spreads via direct transmission, being inhaled by a person while airborne, and through hand to eye, hand to nose, or hand to mouth transmission, either from contaminated surfaces or from direct personal contact, such as a handshake. The Asian flu, like all other flu viruses, can be prevented by a vaccine.
So,
for the next pandemic,
Spanish flu. The Spanish flu started and ended in 1918. It may have started in a few locations: British troops in France, the United States, China, or unlikely countries like Spain, Kansas, and Brest. Despite this, the exact origin of the virus has not been located. Symptoms like a dry cough, sore throat, high fevers, no appetite, and difficulty breathing, like other flu viruses. The Spanish flu mainly spreads via transmission, being inhaled. Via direct transmission, being inhaled by a person while airborne, and hand to eye, hand to nose, hand to mouth transmission, either from contaminated surface or direct personal contact such as a handshake. The Spanish flu can be easily prevented by vaccine, like other flu viruses. So,
the conclusion.
In conclusion,
the Spanish flu is the most severe virus compared to even the COVID-19. But the COVID-19 has only been going on for 6 months now. And in the future, it may reach to beyond even the Spanish flu. So we hope that in the future, the COVID-19 vaccine will be discovered soon, and the COVID-19 will be cured.
So, guys, that's it. And stay safe from the COVID-19 outbreak. So, goodbye.
Bye-bye.